Cardioversion is another procedure that usually doing in emergency room, even in theatre and ICUs and coronary care units. And a patient coming with a fast rhythm, it can be either supraventricular or ventricular. Irrespective of this, with a fast rhythm and signs of instability like giddiness, loss of altered mental status, diaphoresis, high pulse, hypotension, syncope, or if this is there, there is an absolute indication to do a cardioversion. So, doing the cardioversion, it is slightly different from defibrillation. Here we have to complete certain formalities, like first of all we have to take the consent of the patient, and this a signed consent is required. Second one, we must prepare, or our, this is a crash at, our crash cart should be ready, all our resuscitation equipment, emergency drugs, everything should be nearby. And then we have to explain the things to the patient if the patient is conscious. Then we have to give a certain amount of sedation, this because this is something shocking to the passing a current into someone's body is painful and it is very discomfort, it will cause discomfort. So, we have to give adequate sedation, either midazolam or like an opioid, anything we can use depending upon your institution policy. Once this is there, then we will move for the cardioversion. Here you can see that rhythm is it is a narrow complex fast rhythm, about it is a supraventricular tachycardia, where we, this is a biphasic defibrillator. We are starting with a low energy of a 50 or 50 or 70, starting from 70, 50 to 70 is okay. Now, first of all, this is the procedure is same like defibrillation, but we will charge first. Yeah, you can charge it 70. Okay, it is charged by 100. Okay, after charging 100, then apart from the other thing, we have to do something like we have to synchronize. For synchronization, you have to press that synchronize button. And once the press synchronize button, there will be a mark is appearing here, and once because you look at here, this is not getting synchronized now, because the lead is like that, because this synchronize button, oh yeah, definitely it will get synchronized, no problem. Now, it is synchronized, and synchronization, here this the marking appear here, this shows that the machine is synchronized now. The idea of synchronization is to avoid falling the shock in the vulnerable period of the cardiac cycle. If it is fall on the vulnerable period, means it will cause a malignant rhythm like VF and VT. So, now after this, yes, after synchronization, sedation and consent, we will like take the paddle, apply gel, and after applying gel, place the paddle, one on the right side and the left side of the heart. The following the same sequence, I clear means the person who defibrillated to be clear, U clear means this oxygen to be cleared, and someone in the head end is also be clear. All clear means everyone should be clear. Then like simultaneously press both button together, and after pressing you have to keep it for some time to make sure that the shock is delivered. It is not like defibrillation, you have to wait till the shock is to be delivered. Now, like the shock is delivered, and we see that what happened to the rhythm. Yes, the rhythm is now converted, yes, rhythm converted into normal, and his cardioversion is effective.